Deputy Murphy. Deputy Tommy Broughan.
Thanks very much. I'm delighted to have a brief opportunity to speak on the the Health General Practitioner Service Bill 2018. I'd like to thank the Oireachtas Library and Research Service, as usual, for their fine analysis of the bill and on their information on the key issues for carers. It's a very short but important bill. Throughout my own career, of course, I've always tried to advocate as strongly as possible for carers, and I believe that the tireless unpaid work they do is in large part, it still goes unnoticed, unappreciated by the state. Almost 20 years ago, when I was the social welfare spokesperson of the Labour Party, I remember publishing a paper entitled "Caring for Our Carers," setting out the kind of list of basic supports for carers, which I believe at that time were very badly needed. Many of those supports, of course, Minister, they still haven't been delivered by successive governments, including your own. I think one of the areas which we covered at that time was, of course, carers benefit, the introduction of carers benefit, and that was a very tiny step forward. Census 2016, of course, showed us there are over 195,000 carers across the country, and this was an increase of 4.5% on the 2011 census. And of these, of course, as all the speakers have said, just over 60% were women, and almost 53% were in the 40 to 59-year age group. One of the most shocking figures in the analysis, of course, Minister, is the fact that 3,800 children under 15 were providing care for a family member, and almost 1,800 over 85s were also providing care, which was an increase of nearly 35% since Census 2011. And of course, that brings home to us the situation that often members of families find themselves in, and is particularly poignant, obviously, when elderly people and young children have to perform this crucial function. The number of care hours per week, of course, was estimated at full-time job levels, averaging 38.7 hours per carer, or, as other speakers have said again, 6.6 million hours of care per week in total. And the majority of carers, almost 43%, provided around 2 hours per day, and almost 17,000 carers were providing full 24/7 care. And the figures available for June 2018, of course, show that there were 2,747 recipients of carers benefit and 77,384 recipients of carers allowance. 83% of those recipients, of course, already have access to free GP care through access to a medical card or GP card, and the bill before us today is expected to extend this care to a further 14,000 carers at a full year cost, I think, Minister, of approximately 2.8 million. And the bill will provide for this extension by amending sections 47 and 47A of the Health Act 1970 and inserting a new section 58D. Of course, Ireland is the only health system in the EU that doesn't already have offer GP care universally, and hopefully, Minister, this shameful situation will end over the next number of years, either in this administration or the next, as Sláinte Care is implemented. And of course, it's regrettable that this government, when we've had this all-party approach, which a number of deputies all around the House were involved in under Deputy Shortall, that your government seems to be really dragging its feet on the implementation of that programme. We may have made some improvements in that regard since the extension of GP care to under sixes, but it's disappointing to see that the bill didn't include those 29,869 carers, Minister, in receipt of the Carer Support Grant, which is the new name, I think, of the Respite Grant. And you might explain to us, Minister, why you didn't ask for funding to extend it to those recipients, given that many of them are given many hours of care per week to loved ones. Carers, of course, as other speakers have said, experience a huge amount of stress and are more likely than the general population to become ill. 27% of carers over 50 have reported high levels of stress and distress, according to the Department of Health. And the toll that caring takes on a person's physical and mental health can't be underestimated. And of course, we deputies know this very well, don't we? Because week in, week out, we often, we'll meet people who are given extensive part of their lives to caring for their loved one, for an older person or a child, or indeed an adult of any age who has serious disability or illness. Now, Section 4 of the Bill, Minister, provides the insertion of Section 58D, which I mentioned earlier, allowing for persons in receipt of either carers benefit or carers allowance to avail of a GP medical and surgical service. And you mentioned, I think, in your address to the Shannon Minister on July 5th that Section 4 included persons in receipt of half-rate carers allowance, yet the informative Bills Digest, which our library service prepared for us, it tells us that that's not explicit in the bill, and maybe that's something you've addressed in your first speech. I was down in the Budget Committee, I didn't get a chance to hear it, but perhaps you might confirm in your reply today whether persons in receipt of the half-rate carers allowance will also receive a GP visit card. According to the Library and Research Service excellent work, the half-rate carers allowance in Part 3, Chapter 8 of the 2005 Social Welfare Consolidation Act used the term, and I quote, a payment under Section 186A, end quote, throughout. And this bill before us makes no reference to a payment under Section 186A. So are you looking into this, Minister, to ensure that, they won't be excluded? Other important issues, of course, that arise. I mean, what consultation did you have, Minister, and with the Minister of Health in relation to GPs themselves? Of course, the EU average of the number of GPs per 100,000 people is around 91. Yet Ireland, we have the far lower ratio of 64.4 GPs per 100,000 citizens. It's also reported, of course, many of our trained GPs leave the country for opportunities outside of Ireland, mirroring trends, of course, for other health sector personnel. And it's estimated there will be around 26.2 million visits to GPs per year by 2031 due to demographic changes. So, Minister, given this welcome bill today, do we need to offer new opportunities to citizens, particularly citizens, young people from lower income backgrounds, to train as GPs and to encourage, to give strong encouragements to work in Ireland? Another issue that may arise to the bill is related to data sharing and the GDPR. Due to the nature of carers allowance, carers benefit, there will be monitoring of recipients' eligibility for those payments and therefore, by extension, eligibility for the GP card itself. And currently, the Primary Care Reimbursement Service administers the system and monitors eligibility, but there may be data protection issues, Minister, around sharing this information for the GP visit card, and you might come back on that as well. Cathaoirleach National Carers Week took place last month from the 11th to the 17th of June, and I'd like to commend the work of all the advocacy groups like Family Carers Ireland and others for highlighting the need for carers' roles and contribution to state recognised. And the interesting point about a carer, I think, as Deputy Penrose and Deputy Murphy were just saying, of course, is that virtually all of us will be cared for. All of us will be or are or have been carers. So it's something I think that every one of our citizens really understands, and I think there is a deep-seated wish, and I'd echo the comments of my two colleagues, there is a deep-seated wish that carers would be properly valued in relation to the amount of carers allowance and the respite grant and all the other supports that we can get them. It can often be an isolating and tiring time for carers, and carers deserve to know that the National Carers Strategy, the strategy of 2012, will have all the resources put into it that's necessary, and that their lives will be improved and that they will be supported. And perhaps the Minister may have plans, I hope he has, to sort of update that with the current. And Minister, you might know that I'm a member of the Informal Disability Group. I see Deputy O'Quayle on here with us as well, of this Dáil and Shannon. And I think a proposal has come forward from the committee for an additional programme of 211 million euro for supports for citizens with disability, which obviously will be helpful to carers as well. And I hope that that's something that you will, strongly advocate for when you're at the cabinet table, and to demand that you get that kind of money in budget 2019, and that we don't have a situation where you have to come in and tell us, I only got 35 million or 45 million. I mean, it was a very well structured exercise, as Deputy O'Quayle knows, to lay out the kind of improvements that we need in disability services. And as I said, that's a basic price tag across government of 211 million. So I welcome the bill, Cathaoirleach, and I thank the carers in Ireland for the work that they're doing, as I think our whole society does, and I'm delighted to be supporting it. And as I said, I do hope that Budget 2019 will bring further improvements in supports and packages available to carers, and I'd urge the Minister to put forward such requests to Minister Donoghue without delay. And very final point in the last couple of seconds, Minister, we've had a lot of reports about over 70s contacting offices in relation to removal of medical cards, where they lose their medical card, possibly on income grounds, and they get back a GP card. And there's a lot of upset about that and about what may be happening in terms of the limits. And it's not directly related to what we're talking about now, but it is about GP cards. It's something perhaps that you might examine as well and see, in fact, if there's a real problem there. But I welcome the bill, Cathaoirleach. Thanks.
Thank you, Deputy.